Hey, my name is Lori Groh. I'm co-owner at Shoreside Therapies, and I have with me Laila Wickman. And today we're going to be talking about co-occurring disorders. So if it's okay, if you could tell Laila, if you could tell the audience a little bit about yourself, and then I want to hear, we have some questions for you today, and then I want to go into that. So maybe a sentence or two about you or what you've done in the past as far as work experience, and we'll go
Okay,
for.
sure. So I'm Laila Wickman. I started with Shoreside Therapies a few months ago, and my background includes I received my master's from Hazelton Betty Ford Foundation, and I worked there for about 5 years, primarily in the addiction field. And during that time, I realized that I needed to get my therapy license because of the reason of what we're talking about today is co-occurring disorders.
Mhm.
So it kind of plays into each other.
Yes.
So yeah,
Yeah. So I think a lot of people probably don't know what co-occurring disorders even means.
yeah.
So would you mind sharing a little bit about what that means?
Sure. Co-occurring disorders, it's also called dual diagnosis or comorbidity. I can have a hard time saying that. It's the same thing. They're all three the same. They all have the same meaning. And it's basically when a person has more than one medical issue going on simultaneously.
Mhm.
So in this arena that we're talking about today, it's having a substance use disorder, be with drugs or alcohol, and also a mental health disorder together.
Mhm.
And it's difficult enough when you have one,
Right.
and then when you layer, on top of that another disorder, it really can be challenging for that individual to live their life. And
Mhm.
so that's the two of them together. It's just very difficult. And the other thing is a lot of the time when your mental health disorder symptoms start popping up, your substance use definitely will also increase, and vice versa. So it's challenging.
Sure. Sure.
It's very challenging.
Yeah. And I would imagine that a lot of times when an individual is starting to feel some symptoms of a mental health disorder, that
Mm,
they might cope with using a substance, and that
yep,
might, right, that might work for a little bit and then it
yep,
stops working. Yeah.
yep. Exactly. I mean, it's kind of like say you have a little bit of anxiety. Well, a
Hmm.
lot of people think, well, I'll just have a drink and that'll calm me down. And that's fine
Yeah.
if you're a normal drinker,
Yeah.
but if you aren't, that can become a habit and then turn
Yeah.
into a problem.
Yeah.
So,
And I think right now too, I'm sure you've seen all the statistics right now with the pandemic, and there's an increase of, I think is it 30%? Like
yep,
there's this huge increase right now, and what even maybe was normal at one point, normal drinking behavior escalates during a
yep,
crisis that we've never experienced before.
yeah,
And then the
I
isolation adds to it, I'm sure, right?
absolutely. A friend of mine was telling me about a family member who never drank, and
Yeah.
because of the isolation, they started doing happy hours, and kind
Hmm.
of to kill the time.
Yeah.
And it can be problematic. It can
Yeah.
become a problem. It depends on a
Yeah.
lot of different factors, but
Yeah, yeah.
it definitely has
Mhm.
increased.
Mhm. And so how many people would you say tend to have the co-occurring disorders where there's substance abuse and a mental health issue?
I would say roughly about 50% of people who have a severe mental health disorder are affected by substance use.
Yeah, yeah.
It's a lot. And then I think it's like 40% of people that
Mhm.
drink alcohol and 55% of people that abuse drugs have one or two mental health disorders going on at the same time. So it's
Um,
really prevalent. And I think
yeah,
that is
yeah.
underreported too.
I am sure that it is, right? I mean, I think
Mhm.
too, it's hard to know sometimes what's all happening. Sometimes people just aren't feeling comfortable sharing that there's more going
Right.
on. Yeah.
Right. Yeah.
Um, so we obviously we talked about a little bit about substance use disorder, but do you want to give everybody a definition for that as well? Because I think sometimes
Sure.
that can be tricky on, we talked about what's like a normal type of drinking versus when it becomes problematic.
Right. So substance use disorder, it's diagnosed by there are 11 criteria basically
Yeah.
that we use. And if you have like two or three, you end up having like a mild disorder. And if you have six or more, then it's severe. So
Mhm.
some of those criteria include like having difficulty with your school or work, having some difficulty there, having difficulty with the relationships, something with your family, your spouse, your kids. It just things aren't gelling anymore.
Yeah. Yeah.
And having problems with just daily life functioning. Um,
Mhm.
some people have difficulty getting out of bed or taking a shower or feeding themselves.
Mhm.
You stop basically taking care of yourself like you normally would.
Mhm.
And I think that there's also some physical issues criteria that we look at.
Yeah.
And number one might be withdrawal.
Yeah.
It's different when a normal person goes to a wedding and has a little too much champagne and they wait, they kind of feel fuzzy the next day.
Mhm.
That's one thing. But when you start having physical withdrawals, which might include hand tremors, being nauseous or even sick, um, there it's problematic, and
Mhm.
that's something that people really need to be aware of.
Yeah.
And
Yeah.
another criteria is tolerance.
Yeah.
Does it take more for you to reach that level that you're looking
Mhm.
for
Mhm.
than it used to before? So you're drinking a lot more, and then as the disease progresses, there's actually a thing called reverse tolerance,
Mhm.
where your body needs less of that substance in order to reach that
Mhm.
level because your body's just not working the same way. It's not
Yeah.
metabolizing that chemical
Yeah.
like it used to. So,
Yeah.
and another, I think one more criteria, which I think is important, is that people, play games. They're like, well, I'll only drink on Friday and Saturday, and I won't
Mhm.
drink on Sunday,
Yeah.
or I'll only
Yeah.
drink beer instead of vodka, or I'm only going to smoke pot and I won't do coke. It's like negotiating and
Yes. Yeah.
trying to cut back,
Yeah.
and though that's the big red flag right there too. So
Yeah.
those are
Yeah.
kind of the criteria that we look for.
I like that you added the last one because I think when I'm working with clients, that's one that comes up quite a bit. And even
Mhm.
the questioning, do I have a problem or not? And kind of getting in a cycle of that back and forth. And their
Mhm.
minds are wonderful things, but they can play tricks on us, right? And
Absolutely. Yep.
yes,
Yep.
yep.
Denial
And
is a great thing.
yes, yeah, yep. It can get us through some things, but when it starts to
Mhm.
affect us in a negative way or impacts our life, right? That's
Right.
the denial doesn't work very well.
Right.
Something I'll tell my clients is it doesn't need to be a problem for you to want to stop, and
Sure.
I'm sure that that's another thing too is that if you're concerned about it and you're seeing some negative effects, you don't necessarily have to have an addiction diagnosis.
Yes.
Or you could be on the mild end of the spectrum, like you said, maybe not meeting all the criteria.
Right.
But if it's affecting your family life, for instance, that's one that comes up a lot for me in my sessions is other people maybe are affected by it and
Sure.
they might be going to work on time, but
Yep.
not necessarily connecting with the family members.
Right.
Yeah,
Right. There's people say, well, he's a functioning alcoholic.
right.
Well, but what does functioning mean? It means that you're able to do the things that you're supposed to do. However, number one, you're not engaging with your
Mhm,
family and friends. You're not engaging with yourself. You're not growing as a person.
mhm.
So there's so many little minute little things that we need to be
Yeah,
aware of. And it
yeah,
is, good Lord, if we could all catch it before it gets to that point, that would be wonderful. But like I said,
yeah.
denial plays a big part in that because it's a very, substances are very, very,
Mhm.
you know luring.
Yes, yeah,
So,
and tricky
mhm.
and
Tricky.
plays tricks on us. Yes, for
Yep.
sure.
Yeah.
So I want to ask another question that I think would be helpful for our viewers, and that's, besides coming to seek your assistance, what are some other things somebody could do if they're suspecting that they have a substance use disorder?
Well, some things that they can do, number one, is to be aware, to
Yeah.
get sober. I mean, that
Hmm.
sounds very simple.
Hmm.
Um, but if you're working with professionals, somewhere along the road, you can get sober without other
Yeah.
professionals too by doing groups. There are
Yeah.
so many groups out there.
Yeah.
There are mental health groups, depression, anxiety, bipolar. There
Yeah.
are, AA groups, NA groups. For people who don't like that, they could go to a smart recovery.
Yeah.
So there's a lot of help out there. Um, Number two is educate yourself.
Yeah. Yeah.
Education to me is power. The more you know,
Hmm.
the better you can help yourself. I mean, if you had a diagnosis of diabetes, you would want to know, what do I need to do to better myself, to
Yeah.
help myself. And so
Yeah.
education is key. I'm a
Yeah.
true believer in educating. um, Learn ways
Yeah.
to manage your stress. um, Instead of always turning to that, to that pill or that bottle, what can I do otherwise?
Hmm.
Go for a walk, talk to somebody, do something else, learn how to
Hmm.
manage, meditate. There are a lot of,
Hmm.
there are a lot of resources out there nowadays with the computer. Good Lord, you can do anything on it.
I
You
know.
can find meditation. I know.
Yeah, it's awesome.
And the other, another really, really important thing, which I'm a true believer of, is connecting with other people. I think there's a
Yes,
huge,
yeah,
huge unfortunate stigma related both with mental health and with substance abuse. We think that we're the only people out there, and we're not.
I know.
So many people are affected by this, and to be able to share your fears, your
Mhm.
stories, kind of lifts that out of you, and you're not alone. And because it's a
Yeah,
both mental health disorders and substance use is very
yes,
isolating,
yes.
and people tend to, be ashamed and have guilt and all that, and
Mhm.
they just sit at home and it gets worse. So I'm
Mhm.
doing that,
Mhm.
finding new meaning in your life. What am I going to do with my time? No,
Yeah,
because usually, you spend a lot of time with mental health disorders ruminating and just ruminating and
mhm.
playing over things. And with substances, you end up using and getting your substance, using it, and getting over it. What do I do with my free time? How do I structure
Yeah,
my life?
yeah,
So kind of
yeah,
helping and reaching out to other people, big thing.
yeah. Well, thank you for that, because I think those are all really great ideas on what somebody can
Mhm.
do. And there's that idea of the connection. I think
Mhm.
with the clients I work with, that tends to be one of the reasons for the substance abuse in the first
Yeah,
place, or substance disorder. And it kind of is the circle of using and then feeling disconnected, feeling ashamed of what happened, and then feeling very alone afterwards, maybe
Mhm.
avoiding then the people. And then,
Exactly.
there's this big circle with it. And um when you're feeling more connected, then you're not necessarily feeling the desire to use
Right.
as much as well, so
Uh-huh.
I agree with that for sure. I think that's really helpful.
Yeah, it's very
And
isolating.
so I wanna talk with you again. I think this has been
Yes.
really nice, and I'm hoping that for the next like few weeks we can do these Mondays at 11 o'clock,
Cool.
and talk about different topics related to substance abuse, substance use, substance disorders. And we'll see you next week. Does that sound okay?
Okay. Sounds
All
great.
right.
Thanks, Lori.
Thanks a
Appreciate
lot.
it. Bye.
Thanks, Lila. Bye.